Hi, my name is Angela Craig, and I'm starting a series called Articles with Angela. I'm just going to be sharing some studies that might help you in daily practice. Now, this particular study I'm going to review with you is called the KIND study, Knowledge of Intravascular Determination, and I want to thank Stephanie Griffith for the slides. I do have a few disclosures. I am a senior manager with medical affairs here at Baxter, and I am a PRN CNS at Cookeville Regional Medical Center and an independent consultant as well as an advisory board member for Sepsis Alliance. But none of those should impact what I'm going to tell you today. So in this KIND study, it's spelled out as the Knowledge of Intravascular Determination study, and it was aimed to understand the knowledge of frontline nurses regarding fluid status and fluid responsiveness and the use of associated technologies. Now, something that people sometimes get mixed up or interchange is something called volume status and fluid responsiveness. The fact is, those are two very different things. So there is a difference between patient's volume status and the body's ability to respond to fluid therapy, which is called fluid responsiveness. Now, volume status refers to the volume of blood that's circulating in the intravascular system. Fluid responsiveness indicates an increase in stroke volume of 10% to 15% after administering a fluid bolus or physiologic bolus with a passive leg raise. And clinicians frequently confuse those two, which contributes to inappropriate fluid management. So in this study, nurses in all clinical areas were found to still rely heavily on traditional, inaccurate monitoring. 89.7% responded having an accurate measurement of volume was important to them. 96.2% said it's important to know both fluid status and fluid responsiveness. And 63.9% said that volume status is difficult to accurately assess in their current work environment, and only 30% of nurses use technology to guide fluid management. 44 states were represented in this particular survey. And what they found as far as assessment parameters that were most frequently used by nurses to assess fluid volume status of hemodynamically unstable patients was number 1, urine output. Number 2 was heart rate. Number 3 was mean arterial pressure. Number 4 was cardiac output, cardiac index, and stroke volume. Number 5, CVP. Number 6, respiratory rate. Next was cap refill. Next was patient's weight. Next was pulse pressure variation or stroke volume variation. Next was echo or IV ultrasound. And next was pulmonary artery occlusion pressure or wedge pressure. And the next was PVI. And the other was that they just don't use anything. Now, this study can go on, I wanted to give you the reference here so that you can go on and review this at your own convenience. But I think what the takeaway is that there are ways to do volume responsiveness with a dynamic assessment, and there are ways that we can do this well.